I'd like to start by saying that for the last 25 years, I practiced dentistry in Georgia's 3rd District, and I experienced a healthcare system that was broken and in desperate need of repair to reduce cost and increase access to care. After the Affordable Care Act was signed into law, I saw my patients, my friends, my neighbors forced away from doctors who had treated them for their entire lives, and instead of decreasing cost, patients saw their costs skyrocket and their access to care limited. As a medical practitioner, I want what is best for my patients, and those are the people that I am fighting for. My neighbors and constituents who saw their premiums skyrocket, their quality and access to care limited or determined by a government bureaucrat. I committed to them that I would repeal Obamacare and undo the damage that it has done to our health care system. The legislation we are currently considering in the House, the American Health Care Act, is just the beginning of keeping that promise. This is not a choice between a broken health care system that existed before Obamacare. It is a new direction that reflects an understanding of what works and what does not work. The legislation will enact many reforms that directly impact Americans by lowering costs and improving access to care. Tonight, my colleagues and I are going to share with you in great detail what that legislation does. We have been all very open in our opposition to the Affordable Care Act, but it's also important that we share with our constituents what we stand for and what we're working to do to reform this broken system. We stand for patient-centered health care that meets the needs of our constituents in an affordable way. We stand for market-driven health care solutions in an industry that prioritizes personal freedom over government mandates. And we stand for the biggest entitlement reform in a generation to ensure that we protect our most vulnerable populations. This is just a short list of the goals we're working towards, and I'm excited to be joined by a number of my colleagues tonight to help me explain more to the American people what is happening with our health care.